For today, I want to talk about generative AI in medicine. So all of us, we have read about generative AI, and medicine is one of the hot topics nowadays. You can see a lot of AI in there. So that would be the question, to see how generative AI in terms of ethical aspect, because I know you guys mostly are interested about philosophical things and ethical, not that much technology. So I try to focus more on ethical aspect. To quickly introduce myself, if I start from the bottom, it was, first of all, my education was in computer science at GCU in Ireland, 2015. I finished that. And then have been in something called videos for 2 years. Then I joined Intel for 3.5 years as data scientist there. And then I joined another company as head of AI. And after that, I joined university, came back to university as assistant professor for a year or so. Was a little bit dirty for me. Sorry for saying that. Then I came back to industry research center, worked for 4 years, 1.5 years, working on different industrial aspects. And recently, I have started my own company as Intellect to leverage whatever I've done by far. So from here, mostly I used to work on computer vision and AI. Same at Intel. Then it was pure computer science and geowatt. Then at CEDAR, I had the opportunity to actually spread the field of my expertise a little bit toward kind of different industries. From that time, I started working in healthcare. So that's 1.5 years. I'm really interested in healthcare topic, doing projects in healthcare. Wasn't that much interested, but there are the most of the budgets there. Unfortunately, I don't know, but that's the story. Because of that, from 2020, myself and Mikey, we had the opportunity to win the Smart Open Open Data Challenge among 3070. Then 2023 shortlisted with the project in 2 categories, AI Award Ireland. 2024 we could win it. 2025 again shortlisted for AI Person of the Year this year, but I couldn't win it. Among 20 people, I was the third person, which wasn't that bad. But we could win again AI Award Ireland for a project, which was the healthcare project, year-to-year project. That's kind of an introduction about me. So I have been in academia, in industry, working on different industries, on property valuation, on edge AI, and recently for the last 5 years on healthcare, most of the time. So as I said, you want to see how generative AI in healthcare, the challenges, what are the challenges, etc. So we are facing, whenever it comes to healthcare, we are facing with two important and interesting approaches, the curing and caring. Okay, so AI in healthcare initially is similar to a lot of other investors started the curing. I mean, how we can bring the data, create a model to detect the disease, to detect the tumor, to detect something in the x-rays. That was the first time we tried to bring AI into that. So traditionally, technology in medicine has been good for diagnosis and intervention. It focuses on the mechanics of the part. Okay? That was the first idea of a usage of AI. And then they started recently shifting a little bit more toward the caring. So how we can start care people, not just cure people, not just treat people, but help them in terms of curing. So generative AI started entering the domain of interaction and empathy. Okay, so that was a little bit shift in paradigm that happened. So again, if you look at that, as I say, the traditional AI focuses on mostly on diagnostics and prediction, like a tool for the doctor to analyze data. Is it the cancer? So the project we won the AI award this year is exactly about the same. So how 2 years in advance we can detect the cancer, the risk of cancer in patients. So most of the patients, unfortunately, in the higher stage are diagnosed. So the plan was to leverage a lot of facial data, EMR data, to detect the cancer in advance 2 years. So this is the traditional way of using AI. But as I say, the impact was optimizing curing. The most problem there was like engineers, they were thinking about the performance. The model has 98% accuracy, but how much is it important? So during that project, we had the opportunity to talk to oncologists a lot, and it didn't make sense to them. So what do you say? We don't care if it's 93, 98, 70, 80. We don't care at all about that. So that's something else is important. Of course, for that, we had the opportunity to validate models in clinical setting tool, which started giving us a lot of more understanding. So, for example, one of the factors was, what is the window you want to check the patient? I mean, a 3 months window you want to check. Factors that technical people normally don't think about. But then, as I said, the generative AI focus is on creation and interaction. So, like the Papier that creates solutions, drugs. Is it possible? In another European project proposal we recently finished development was about, we have loads of clinical trial matchings. Drug factories, pharma companies, they are developing solutions. From this side, we have the healthcare system. The problem is some of the patients should attend these clinical trials, right? But the problem is it is really difficult process. I mean, patients' history should be studied crazily. Pharma companies, they have the inclusive and exclusive list of criteria. Healthcare system, they need to sit, review, plan, discuss, decide, and then talk to the patient, encourage them to attend to the clinical trials. But the problem is not that many of the patients attend these clinical trials because of the risk. So a lot of solutions are already there without being tested. So pharma companies, they are creating solutions every day, but a lot of them, they are like, don't have the opportunity to be tested. So again, generative AI, I'm trying to bring another example. Generative AI, what it does is it helps facilitating that process. I mean, in that project, you say, we want to create a digital copy of the patients. Then that digital copy can test 1,000 trials without any concern about the risk. If we select this a specific trial, if it doesn't work 1 year later from now, we will lose the chance. Patient wouldn't have that much chance to be saved. But if it is a digital copy, and then how we can imitate that, how align them? If you take this medicine, how would be the situation in next 3 years in your digital copy, and which one works the best? So this is where generative AI started creating as the interactions. So the impact is accelerate curing and automate care. So this is the shift we are talking about. But then you probably can come across this question and ask yourself, okay, you say traditional was mostly about curing and generative AI is mostly about caring. How about the other way around? I mean, traditional one used to do anything about caring, or the generative AI does anything about curing? The answer is traditional AI is not about caring anything, but yes, generative AI does both. Curing and caring. So this is the good news to understand. So does Gen AI do curing? Yes, absolutely. Did traditional AI do caring? Mostly no. So this is the real shift. So shifting from traditional AI to generative AI, we have the opportunity to not only look at the curing by generating new medicine, by testing the clinical trial matching, so on and so forth, but also the caring. The caring part is something generative AI can help us a lot with. Okay, so let's define the scope and what is the situation with generative AI. As I said, more than prediction, it is creation. So in predictive AI, as I said, the question is this tumor malignant? It is analytics. But in generative AI, we, for example, can say, decide a protein that targets this tumor. Okay, or write a compassionate letter to this patient. You might ask yourself, what does it mean, the caring part? Look at that example, write a compassionate letter to the patient. I mean, when you attend your GP or any hospital, etc., for a blood test, etc., nowadays, you normally receive text message saying, this is the result of the test. Doctors normally do that. But generative AI slowly started doing that. So how compassionate it is, how the text is, the text is formed in terms of generative AI. A doctor knows, oh, this is my patient. I know him for the last 10 years. I know his personality. I know he's really sensitive to the words. I know he's going to search Google to see what does it mean. So I should be careful. How about AI? AI cares about these things. That's the matter of caring and generative AI. The philosophical leap here is that We are granting machines the power of creation, not just calculation. That's the story of generative AI. Some examples could be interesting apart from the examples that I read. So, like the biological shift, Google years ago introduced Google Health Mammography AI toolkit. So it was, as I said, looking at the data, the X-ray, and say there is a 95% probability of tumor here. It was the case. Why is predictive? Because analyzes existing anatomy packs like a superpowered magnifying glass. Right? But now look at the changes generative AI has brought to the product. For example, Google has introduced AlphaFold 3 from the Google DeepMind section, or in silico medicine, that's another example. So what it does, you give it a disease target, designs a brand new protein structure or drug molecule that has never existed in the nature to bind to the target. We didn't have that opportunity. What we had previously was, this is the data, tell us is there is a risk of something or not. But now we can say, this is the problem, can you find a solution for that? That was previously human used to do that. So finding a drug hidden in a database, hallucinating a solution from scratch, act like a molecular architect, these are the things that generative AI can do. But perhaps you have the question, the philosophical, ethical question here. So we are saying hallucinating a solution. So like a ChatGPT, like a human jump there and start asking something, but how factual is it what you are saying? So when it comes to healthcare, that's more dangerous. You are designing a molecular structure. So how we can ensure it's not harmful for human? This is the question. So that's why in the next couple of slides from here, we will start discussing the challenges of generative AI. So this is another example, the relational sheet. Okay, so look at this one. So Epic species model, that was something watches patients' vital in the background. So if a patient is in a hospital, there is the EMR system, all the data of the patient continuously checks all the EMR data. And before anything, its risk of sepsis is highest in 2 hours in advance, it can alert there's a risk. Let's start doing something, which previously without AI, human needs to do the test. If they see any changes in patient's face, they need to start thinking something, doing something, but nowadays using AI, you can automate the process. Why it is predictive? We discussed that. But now using Yuan's text Copilot, it is completely different. It listens, for example, that's an example. It listens to a 20-minute consultation and write a perfect clinical notes. It was really, you remember in the like 20, 30 years ago when you attended for X-ray or this kind of medical imagery, it used to be, the result would be ready in a week or so. Why? Because a specialist needs to look at the thing and generate the result. So now how it can be generated automatically? I visited my GP last month and he was saying that whenever I go there, he talks about AI to me, of course. So I should charge him too. He should not only charge me. So yeah, he said, I always say my secretary that it is beyond like taking the note what I'm saying. It should be AI is beyond that. Yes, of course, but it is still very interesting. You're listening to the conversation and creating a note, okay? Or draft a compassionate email reply to patient explaining a test result, which would be this. So this is the aspect of the AI. So now, well, after looking at what does it mean, the traditional AI, what does it mean to generative AI, the relationship with curing and caring, what are the changes it has delivered to the healthcare environment. Let's have a look at the ethical challenges here. So in bioethical space, we have had 4 principles. They are not new principles. We have always been faced with these principles. The first one is autonomy. I mean, the patient should have the right to decide. So that's why in the old CK system, doctors sit with the patient, explain to them, this is the surgery, the advantages, disadvantages, etc. And you are the person who should decide if you want to take it or not. So this autonomy has been one of the bioethics principles long time ago. This is the first one. The patient's right to make informed decision free from curation or hidden algorithm manipulation. The second one, beneficence. I mean, it is supposed the solution is helpful, it's useful for patients. It should be. It is one of the principles. So the obligation to act in the patient's best interest, ensuring care actually improves outcomes. It is not about the percentage. I don't care if you tell me my model's percentage is 98%. It should be toward the best of the, like the best of the interest of the patients, so that the statistic is not. The third one, it do not harm. It shouldn't generate any harm to the patient, right? So this is the third principle. Avoiding bias, hallucinations, errors that lead to injuries or negligence. So this is the third principle. And the last one is justice. So fair distribution of benefits, preventing AI from amplifying existing inequities. You know what does it mean? So that's one of the challenges of AI. I mean, nowadays, AI is going to help a lot of people, but the question is which countries are going to receive the most benefit of which group of people in the community are going to take the most of benefit of that. These are the 4 bioethical principles. From here, we want to see how these principles of challenges in generative AI. Okay, so the bias problem. Bias problem is part of what? Bias problem is part of justice, the last one. Okay, so generative models are trained on historical data. You know what does it mean, the bias? You mean that we train AI on data set, on data, and if there is a bias in the data, whatever we train would have the bias. Of course, bias doesn't happen only in the data. Bias happens in the algorithm too, okay? So this is the question. So case study in dermatology has been this one. So models trained primarily on lighter skin tones can to accurately diagnose or generate synthetic data for darker skin tones. So that has been the problem. In generative AI, we are facing hugely with this problem. We need to be really careful with the data because you might say, I understand traditional machine learning model. I've had a model. We used to have like training and test stages. We used to have a data set, very good data set. We train the model and so on. So forth. But what about the generative AI? Generative AI is models. They are the models we train on the data. That's the same principle. So although they are generative, the ChatGPT is an example. How ChatGPT generates answers for you. ChatGPT has been trained on billion and billion of data. So they have the predictive capability. They can predict what is the next, right? So bias is very important. It is, if bias is not mitigated appropriately, we will be facing the failure of justice here, okay? So this is the solution. I mean, let's see how we can address this kind of ethical challenges. So the solution case is synthetic data augmentation, okay? So as I said, the problem traditionally has been we don't have diverse data to address the bias. Unfortunately, we cannot come back to generate the new data. But the solution depicts using generative AI here has been researchers are now using generative AI like a stable diffuser to create synthetic, hyper-realistic images of skin condition on darker skin tones. This is where generative AI. So we have a challenge. Using AI can help a lot in terms of curing. But the problem of the principle is if there isn't bias, violate the justice, then generative AI jump in. Generative AI allows us to generate new data. That allows us to train the model in a way there is more justice, there is no bias, which is the solution, as I say. So the result, they fit is hallucinated but medically accurate images into the diagnostic model. The model learns to recognize cancer on darker skin, closing the accuracy gap. Okay, so this is one interesting. Nowadays, if you're working with Gemini 3, nowadays the nano banana, that's insane. I remember in 2016, I was doing research on face detection, etc. That was really difficult to collect data. But nowadays, if you have an idea in your mind to develop a model to do something, if you can write your code in a good way to generate good data set for you, that would be insane. I mean, that's why generative AI is helping me a lot here. The other example. So let's see how it works here. So the hallucination risk. It's kind of it violates which principle? If you think about it, the hallucination risk, the bias risk was violating the justice. How about this one? If we come back to this slide, which one do you think it's going to challenge? So most probably it's going to challenge the not all. Okay, why? Because if you look at that, you will see, okay, so in the pharma industry, where we develop a lot of new drugs, we need to develop new proteins, we need to develop new molecules, etc. So Gen AI can design novel proteins and drug candidates at superhuman speed, right? But the question is, these are probabilistic, yes, not biological certainties. So the question is, a molecule may work perfectly in an AI solution, but fail or cause harm in the human body. So you can generate any potential combination of different things to generate proteins. Well, are they useful for the human? They're violating that's a specific reason. So the speed trap. The pressure to trust the AI's query reliability can lead to bypass rigorous let's say trials. Okay, we are rushing to trust the simulation because it is cheaper, but it is an important problem. Okay, let's see what is the solution here, the real world solution for that, or the vet lab loop. So in silico medicine has delivered the solution. So while you're talking about generative, since I have a lecture in university for more than 10 years, I always try to follow what I'm talking about to ensure it makes sense. So we are talking about Gen AI is going to help a lot. We are talking about there are a lot of risks. We showed the risk and we are showing how it should be mitigated. That's an example. So in silico medicine has done this. So they generate, the Gen AI proposes a novel molecule. They hallucinate, generate a lot of combination of the things. Okay, then robotic synthesis, automated labs basically create the molecules. Biological testing, the molecule is tested on the cells. We are not just hallucinating. We don't know which one is powerful, which one is useful. We are testing them in the lab, and then the feedback, the results, success or failure, are fed back into the AI to retrain. So this way, we are hallucinating. In the higher speed, we are generating new proteins, new cells, molecules, etc. But this time, they are not as harmful as they are supposed to. So the real world proof. In silico medicine, use this loop to bring the first fully AI-generated drug for fibrosis to phase 2 of trial, which is very good, interesting, and fantastic. The anti-hallucination fix, as I say, they didn't just generate one mix. They generated thousands, synthesized the top candidates in the lab, and then found where the AI hallucinated. Okay, so this is an example how we can address. Let's talk a little bit about the accountability gap, which is very important. This is the area I think for philosophers will be most important, most interesting part I have. So who is responsible? We have it in different industries, in automated industries we have, as well as we have in the healthcare industries. So when a generative model misses a diagnosis or recommends a faulty treatment plan, who is the responsible person for that? Is it the developer? If AI does anything, recommend anything, if it fails, who is the responsible person? The developer, often shielded by support through disclaimers. There are disclaimers. The doctor, can they reasonably be expected to catch an error? Imagine you're a doctor. Imagine there's AI with that kind of the performance numbers, etc. And imagine AI tells you something which contradicts with your opinion. Do you dare to say AI is wrong? That's very difficult. So the gap, you face a diffusion of responsibility where moral agency is lost in the algorithm. Yeah, so this is the story, the gap. If AI misses a diagnosis, who is liable? The doctor, human error, or developer? The legal presumption of causality. What does it? If the AI is a black box, and hard accused, the court presumes the AI caused it. So kind of you have found the solution. But this shift the burden of proof to the tech giant, not the patient. Okay. In terms of the market fix, so we have the legal fix for this scenario is if AI is black box, that's why explainable AI and things like that are working really hard to make AI explainable through. That's why we don't have automated car in the market because a lot of decisions are not explainable. We cannot say. So in terms of the legal fix, that's the solution. In terms of the market fix, indemnification of clauses. Hospital require vendor to pay for AI logs. That would be the solution. Real world scenario, FTC versus retail, which I will explain in the next slide. That's a real case example. So there is the pharmacy chain called Rite Aid, if you have heard the name. So they have released the software to like a surveillance system to detect people faces inside pharmacy to see if there is any likely shoplifters, people who steal things inside the pharmacy. And unfortunately, the algorithm started to classify a lot of black and Latino people as criminal. And even in one case, a 11-year girl actually was detected and they started to checking everything to see if she has stolen anything or not. So this has been the case. So then FTC, Federal Trade Commission, did just find it to say you have made the mistake. So this is quite difficult to step to our other thing is generative AI. So they have said they called it algorithmic disgorgement. What does it mean? Not only they sent them a file, how much you should pay as a penalty, but also they said you should delete the algorithm. Reason was forced to delete the algorithm and all the data received from it, they were banned from using facial recognition providers. So the penalty is huge, which is very good news. So it makes AI more kind of safe, let's say. So why this matter for medicine? This sets the precedent that if a medical AI is found to be biased or harmful, like the demographic case, etc., they should kill the model, they should keep the data, they don't have the right to keep it at all. This is another famous example probably you have here, the Cambridge Analytica case. I'm not sure if you have heard the name. That's one of the biggest scandal ever. So a professor at university has launched an application like personality quiz. This is your digital life, was the name of the app, something like that, on Facebook. And they were like almost 300,000 people paid for it to answer some quiz to find out what is their personality. And the purpose of that app was for academic research only. But because of some problem in Facebook algorithm, not only they could have access to those people who have paid for the application, but also they could get connected to the people who are connected to this people. At the end of the day, they could have access to 87 million profiles. Not only the profile, but also the sensitive information of their activities. And then they went beyond. I mean, that professor has sold the data to Cambridge Analytica, and Cambridge Analytica started using that data in several cases. One of them was for the Trump campaign. They used the data to manipulate election and voting to understand the personality of people in terms of voting, etc., which was crazy. And the second one was the Brexit. In Brexit also, they manipulated the people's opinion, understanding what is the story. So then again, the bridge was harvested data from 87 million users without consent via a personality app, like a quiz app. Like, as I said, this is my digital life. And the average was, as I said, they started getting access to a lot of data. The penalty, the FTC ordered algorithmic disgorgement, forcing the distribution of not just the data, but any mother's data or mother, anything should be destroyed. This guy, as the CEO of Analytica, they kind of went bankrupt because the penalty was huge. They couldn't afford it. They filed the bankruptcy. They exited the market, and that was the result, which is very good. I would say it is very good as measure to ensure what we do kind of safe people. It is very safe for people. So the medical warning, if you build the medical AI on unethical data, regulators can order the death of your mother. It is very, very important. I mean, see, look at that. The stories started with a researcher in university. Sometimes, as a researcher, we are really passionate in terms of let's have today access to data. Let's implement the idea. Let's generate a new algorithm. Let's publish it. What they are responsible. It's not like I remember in terms of GDPR, as a technical people, always the question was who is responsible for GDPR? So this is not like a department inside the organization who care about GDPR. Everybody should care about GDPR. If you're a technical person doing something with data, developing the model, you are responsible for GDPR. Everybody is responsible. When we are talking about ethical aspect of AI, that's the same, even more important. So everybody is responsible for being careful in terms of the way you are using the data. Consent is very important. The way we use that is very important. Transmitting the data, transferring the data is very important. We should be carefully handle everything. Okay, let's have a look a little bit to the. So we talk about the curing bipolar. Let's have a look a little bit to the carry to see how the things can happen. So you should know this guy. This is Weizenbaum. He has been uh, academian person, German American computer scientist Joseph Weisbaum. I assume that's the pronunciation. I don't know the German that much, but anyway, he used to live in mid 1960. So he designed a chatbot which was called Alireza. That chatbot was a psychology chatbot kind of. People could play, ask questions, etc. And then they started, and that was the structure of the question, like here. So my mother makes me unhappy, and that chatbot is really like some logic. So I mean, if I had this, if the user tells this, ask this question. If there's some, if an else and then so things like that. Okay, so the question was like, my mother makes me unhappy. Mike elicit the response, tell me more about your mother and things like that. So what is the problem and why the wise button effect happens? So he actually came to the idea that say it seems like people trust machine more than a kid. They feel like that's human. That's the trap word human. If anything conversational happens, we feel like we can trust it. Well, this is a machine. This is not trustworthy. And that's the reason we can see a lot of the news in terms of ChatGPT and other tools. I was reading an article from BBC, a woman in Ukraine after the war started feeling lonely and then started talking to ChatGPT, asking. So she started getting good feeling, etc. But at some stage, ChatGPT started giving very crazy recommendations. So that's the human. That's the problem human does. Okay, so people interacting with it is a quick. It became emotionally attached to the program, confining it, finding in it as it were a real therapist. Look at that. That's in 1960. It was like really naive at that time. The chat was that was a Q&A mostly. It wasn't intelligent chatbots. But look at the situation at the moment. We had huge number of new chatbots, and they are really, really crazy. I mean, if you want to, write down on a paper occasions that we have trusted chatbot, I'm sure almost all of us we have experienced the situation we have trusted chat was crazy, So this has with the question, the illusion of empathy, human tendency to project their own complexity and intention into machine that merely single conversation, as I say. What was the with Baron Barney? He argued that just because computers can perform human-like tasks does not mean they should, especially in role requiring human judgment, etc. So that was a very kind of awareness that, and as I said, in LLMs and the new era, you can see a lot of much more sophisticated chatbots that's all based on conversation, and they're dangerous. Even in the school, to the kids, they teach if a stranger talk to you, be careful. Conversation looks like that's one of the craziest problem of human. I mean, that's the way to make trust. The chatbot are very dangerous in terms of that. The fake empathy, as I said, that's the fake empathy stuff. So the Weismann effect, humans are hardwired to project emotion onto anything that mimics conversation. And generative AI is the ultimate mimic. Okay, so what is the deception? Is it ethical for a chatbot to say, I care about you when it has no feelings? I don't know if you have experienced anything. Yeah, recently I experienced, to be honest. I experienced on a quick occasion. I pasted the reply to an email in Gemini and said, oh, that's a very sad answer. I'm so sorry about that. Are you sorry about that? Really? I don't know. So that's a very important question, okay? And then ethical question. Is it acceptable to use emotionally manipulative language even if the user receives some form of perceived comfort or help? So this is the fake empathy problem we have to solve. So we are facing with dilemma here, okay? So we are facing with transparency and autonomy violation. So which one do we want? Should AI say, I'm not human. I don't have any feeling. I cannot recommend anything, or should hide it? Which one? If it is transparent, probably it will lose the credibility in terms of helping humans. I mean, or helping any aspect of the healthcare in terms of AI. What if you hide it? You are facing with autonomy. Do you remember the four principles? The first one was autonomy. I mean, giving the patient the right to select the best solution. Correct. So this is the dilemma we are facing here based on whatever happens here. Yeah. So that's the erosion of moral agency there. So human agency is the doctor says the burden of a decision. Doctor says, oh, I cannot do this surgery because of this and that, or I can do this surgery because of this and that. But how about AI? So AI has no moral agency. It can simulate cancer, but it cannot take responsibility. Shifting care to machines strip healthcare of its shared moral burden. So this is the real challenge in terms of erosion of model. So let's have a look at another use case. So the TISA. TISA has been again a chatbot. Okay, so that was a chatbot to help people in terms of eating and diet behavior. So the people used to talk to the chatbots to ask questions. I have this problem. I want to reduce the weight, etc. What is your suggestion, etc. So then that calls the application NEDA, which is a Persian name anyway. Interesting. So this is that's a chatbot. So they replaced the human helpline staff with a chatbot named Chiza. The failure was Chiza begins giving healthy eating advices to anorexic patients. Others are suggesting they count calories and use the skin clippers to measure body fat. What was the moral agency gap there? That was a human counselor would intuitively feel the moral danger of eating diet to stop the improvement. This is a problem. And as you can see, these two ideas and examples, they say chatbot cannot care like we do, help by worker to speak up on the whole ETVs or the action day. So this is again another example. This is another real world example, the robber startup. If AI in X-ray images detects something, can doctor stamp it and say yes, see, or no? This is a big question for the doctor. Okay, if I disagree, and that's the problem. If I disagree and I'm wrong, I'm liable. If I agree and machine is right, that's the system error. So that's a really crazy situation. What should we do? So recently we are working on the endodontist project. So the plan is for GP dentists. They normally take the X-ray, but they don't have that much expertise to understand what is the problem. So the algorithm is going to detect the problem with this X-ray and generate a treatment plan. And then the GP dentist would be kind of an endodontist in the office. Okay, so that the question is, can you start with that treatment is something you should follow or not? That's a ethical challenge. Okay, so as I said, if you disagree, that's a problem. If you agree, that's a problem. But in the previous slide, a few slides before this slide, you discussed a little bit about what would be the legal and market solution for that. In terms of the legal, we need to do what? In terms of the things, what we can do with that. And let's have a look a little bit at the EU Act situation to see what is the story. You probably know about the AI risk pyramid. So we have unacceptable risk on the top, we have high risk, we have limited risk, and we have minimal risk. So unaccepted risk means if there's any application you are doing, there's unaccepted acceptable risk, you shouldn't do that. But they shouldn't generate any AI solution with that respect. So that one is kind of very crazy and we should get rid of that. But the high risk healthcare is in the high risk and it is very important to consider that. And then education, also employment, justice, immigration law, they are all of them in the high risk. And then the question is, what is the situation in terms of EU hack, in terms of generative AI capabilities? So we have something which is called medical keywords regulation alignment. So most AI system, it is very important. So when we see the word device there, they might think it refers to the devices, the physical devices, but it's not the case. So most AI systems used for medical purpose, such as diagnosis, prevention, monitoring, prediction, prognosis, treatment, and elevation of diseases, are considered medical devices, which almost means everything in healthcare. And then, so if it is the case, they should be treated under if a medical device requires third-party conformity assessment under the EUMDR, the AI components automatically classified as highest, and we have approval Annex 3 use cases. We have specific healthcare related use cases are explicitly listed in Annex 3. So AI system used to evaluate and prioritize emergency calls. AI system for patient triage. AI system that influence an individual rights to access healthcare services or public benefits. So these are the areas that UI talk about. So there are few aspects should be considered in terms of risk management. Developers, as I said, must establish and maintain robust risk management systems. Okay, risk management is on the developer's shoulder. Nobody else. You cannot say I'm a researcher, I'm a developer, I develop a model app and I don't care if there is. No, everybody should care. In terms of data governance, high quality data set and data governance measures are mandatory. So we should care about the data. It's not like just having access to the data. Data is very cool. So human oversight must be in place. Humans should look after, should leave everything from the house as black box. Humans should be involved. So that means mechanism for human oversight must be in place, ensuring that the person can monitor, overrule, or stop the AI decisions. Conformity assessment systems must undergo rigorous conformity assessment before being placed on the market. And technical documentation registration. In terms of EUAI, 2024, it has been released. This year, we have a little bit, it wasn't like obligatory start implementing that, but from 2025 on, already we have started doing a little bit of things, but in 26, 27, and onwards, there should be obligation for all the companies to consider doing that. A lot of companies underestimate technical documentation. It is required that at least for the 6 months you keep and hold all the documentation of whatever you do in terms of AI. It should be in place. That's underestimated to me because I'm a technical person. I know uh, we care about the shorts, we care about performance, we care about these things, but that's really important for us, documentation about technical prepared, which is a problem. So it is really important. So extensive technical documentation must be maintained, and the system, as I said, 6 months is the duration for the last 6 months you need to have. And we are almost there. The oversight paradox, a critical tension between legal assumption about the human controllable AI. So the legal, the law assumes a human doctor can fully understand, evaluate, and if necessary, override the superhuman AI system to prevent that. This is what legally, sorry if you have a doctor in the room, but I know that's difficult for you. I have sent a lot of long message on WhatsApp explaining that is what does it mean, the Bitcoin, what does it mean, AI, etc. But AI doctors in the next generation, they need to understand AI. They need to be able to work with that. So that's the visual aspect. What the cognitive reality is automation bias. If an AI diagnoses a rare cancer, the doctor needs, will they really override it? That's something important should be addressed and should be discussed. The core issue is that The legal and ethical framework asks you human oversight is effective and reliable. What human cognitive bias make is oversight functionally critical? They have not addressed it yet. So if it is not impossible. So that's something really important we need to think about. We have the scenarios here, as you have already. The middle one is the autonomous vehicles and fatal crashes we are familiar with, which has happened in terms of Uber incident in 2018. In terms of the medical diagnostic and radiology, so we have one scenario here, the paradox in action. Can the AI provide an correct suggestion? The radiologist accuracy significantly decreased. And the IBM Watson perhaps has been the first one in the new era of chatbots. So they started doing that in 2015. Wasn't like ChatGPT 2023 ChatGPT kind of revolutionized everything of the chatbots, but before that, IBM Watson was the case, and in the oncology, they have been one of the cases. So these are just some use cases there. And in terms of how, so we need to leverage technology. So some of the question I had in some of the presentation before I start, but I didn't find time to ask, was about this. So we are talking about all these challenges, but the question is how technology can help it. I mean, people in the law, people in philosophers, etc., lawyers, they can start thinking and addressing the thing. But the question is how technology itself can help addressing this thing. Because with human knowledge, that's really difficult to address all these challenges. That's my view. I think technology also should change. For example, in terms of the technology and chatbots, RAG has been a huge help. So if you're familiar with, so if you work with ChatGPT, when you send a question, a prompt, the answer is generated from whatever is learned. How old is the data, or we have trained the model? Uh, these are out of our control to answer you. But in terms of RAG, you support with the document and you chat to the document, which is more reliable. Okay, so this is one of the cases. So it helps us to get rid of hallucination a little bit. So for example, notebook error, if you have worked with Agicom, you'll be jumping to looking at services. Google didn't pay you to do that. But well, that's what I'm saying, because Google has a lot of like integrated services together. For example, Notebook LM, if you add the document, if you upload the voice, if you add anything, you can start talking to that specific document, which help a lot in terms of hallucinations. Uh, mm, yeah, so a Canada chatbot is an example in terms of hallucination. Whenever it wasn't a RAG in 2023, and there was a lot of like they say you are liable for some refunds, which wasn't the case. The chatbots recommended that. It wasn't the case, so they started complaining and filing a case. The airline liable for the chatbot's misinformation or the irregularities. Okay, so as I said, technology has helped you. So if you have a RAG, if you have all the rules, if chatbot is supported with that document, it would be much easier to go beyond that. And RAG, the understanding is the common understanding is RAG is related to text, but it is not the case. RAG can be applied to any kind of other fields, the images and so on and so forth. So of course, unfortunately, in vision, we are behind the text. Uh, we have been good. I have a good news for you. We have been good while 2015, and then from that time, as soon as we started learning how to generate large language models, then vision kind of went to the corner. Nobody looked at that. That was the problem. And you have heard the news about Lucan. Lucan was the AI director at Facebook. He recently announced he is going to exit Facebook. And the main reason was he believes LLMs are overestimated. So that's his belief, which I think that's a good one. He says if we rely on generating more powerful LLM, at the end of the day, the intelligence behind is like a cat. It's not like a human. So according to him, LLM is dead. It doesn't work anymore for creating that common knowledge. What he suggests is, he says you should learn from real world, from the physical interactions. And that's why he announced he is going to exit Facebook. He's going to start his own startup, and the focus is to learn from the world. which computer vision again would be really crazy because we learn the interaction in 3D. You learn the interaction between the teams. Why this kind of this desk is imbalancing here? Why if I put it a little bit there, it falls down? We need AI needs to learn. ChatGPT at the moment doesn't do that. It is really mimicking some text, etc. And let's go to our finishing the things a little bit more of technical solution. So if you're familiar with the Swiss cheese, the image on the top is a Swiss cheese model for COVID-19. It is not a technical, it's not a neural network. It looks like a neural network, but it is not. But the point is, if all the holes are matched with each other, any problem, any risk, we go to the solution and we are facing the problem. What it suggested, we need to prevent matching the holes in a row. If anything, so look at that mass hand hygienes, like avoid touching faces and so on and so forth. Some of the personal responsibilities and some of them are shared responsibilities. So we need to bring such an approach to treating these ethical problems to ensure, like in layer one, if we look at the models and technical, the data curation, we need to get rid of the bias. In layer two, we need to work like model alignments, reinforcement learning. In layer three, like clinical workflow, human in the loop, and then we can go for post-market surveillances and their principles with nothing about that without. Have you heard that? If you have heard that. So it is very important. So let me explain this. Yeah, so it means don't design any solution in healthcare without considering us as human. So we should be involved in the design. That's very important. I have design guardrails, cognitive pacing functions to solve the oversight paradox. We must design interfaces that prevent passive acceptance. Don't a simple upper button. Do require the doctor to type their reasoning before seeing the AI's confidence. Who knows? I mean, for the doctor, instead of saying yes or no to what AI suggests, doctors can write the reason. I mean, AI then can look at that and say, oh, you say, understand what you say. So maybe I'm wrong. Maybe AI say, okay, I change it. That would be maybe the solution. The goal is add beneficial friction to preserve human cognitive agency. And that's the final challenge, final slide. We are building systems that think queue faster than us and simulate care better than us. The challenge is not just technical, but philosophical. How do we preserve the human value of responsibility, truth, empathy in an automated future? But still, as I said, I believe technology still can help a lot too. And fight it more, but I could finish beyond.